I've always been very curious to see how public policy and public health can intersect. And I think today's event by Quit Like Sweden is a really good opportunity to find out a little bit more about how countries around the world are looking into harm reduction, looking into tobacco control. I think most importantly is that looking at the evidence presented in the research to help us inform our decisions here in Malaysia.
I think this is very important to learn from best practices. And I think Sweden, the first country that have smoke-free country, it's really important from Malaysia that we know our condition is very bad in terms of illicit trade, and also we fail many times in terms of curb cigarettes. So I think this is the platform that we need to exchange ideas and best practices.
So firstly, I got invited by my friend, and then this thing is quite interesting because it's also related to my background. So talking about vape, why can Malaysia quit like Sweden? So it's quite interesting. Then which I get to learn a lot of things lah, new knowledge actually.
My research is about this topic. It's about vape. And I think I'm very interested to join this event because it's related to my research topic. Other than that, I want to expand my connection here so that I may know more about vape and I can increase my knowledge about this policy about vape and etc.
I think actually the most interesting part is that the Malaysia research component of the presentation, right? And I think it's very interesting to see how Malaysians view the different products and how it affects them. And I think especially for young people, it helped me think about like whether we're actually well equipped to understand the differences in the different products and the consequences to us and our body and our communities. So I thought that was one of the highlights of the presentation.
So I think one of the best, the valuable lesson is actually how the government should adopt alternative methods in terms of giving the alternative to the consumers, because nowadays consumers don't have opportunity to explore what are the alternatives besides smoking or cigarettes. So when they have been introduced in terms to the new alternative product, which is the safer product, so they definitely wanted to quit smoking and change into the safer product.
Firstly, is like what we get to know from Sweden, what is their initiative, what they have done about this initiative on quitting vape. So besides of the ingredients of the vape, tobacco, nicotine and the tar, which actually is very harmful for our health. So besides that, with the talks that has been conducted earlier on, we get to see what Malaysia can do in. I think it's still far for us to just simply stop vape, for example, but the steps that we can take, a baby steps we can do on how we can, to make vape, is it a good thing or is something that is harmful for us? Yeah.
So I think one of the valuable lessons that I attend to this event is about the policy making, from this government and from the industry, what's their perspective about this vape to implement vape and what's the next step, so that we can, as doctors, that I can try to get the patient any choice to stop smoking. Yeah, so I think that's a valuable lesson to me today when I attend this course.
I think as someone who follows public policy in Malaysia, I feel like it's always very important to ground our understanding and our advocacy on hardcore, hard research, database recommendations. So I think today's session is a good start. And I think for moving forward, we can't just look at today we got a glimpse of some countries, right, and a comparison with Malaysia. But hopefully Malaysia also invests more time and effort into this kind of research and discourse, so we can also widen the conversation and not just looking at industry perspective or like practitioners perspective, but also the consumer's perspective, right? What are they understanding? Do they actually understand what's being put out there, and how do we have a mature discussion that involves all stakeholders?
I hope in future this will be adopted as a policy in Malaysia, especially by the MOH or Ministry of Health, to be implemented at the grassroots level, we have klinik kesihatan, we do have klinik desa. It should be implemented at that level, so then the smokers or consumer can access to that information and they can have a better option.
I think more talks like this should be done actually, and then bring in more stakeholders, which I mentioned, people from the government, the ministry, agencies, the manufacturers, and maybe some other NGOs, to brainstorm and to talk about this initiative, because we don't want something that we just talk, but there's no implementation. So we compile the data that we have. You love data, right? With the data, we can present to the government, to the stakeholders, where we hope something can be achieved with this thing.
Malaysia can quit like Sweden.